right, ladies and gentlemen, it's time now for the health facts here at WVOE 1590 with the Dr. Brown. Stay tuned.
All right. All right. Thanks for that introduction. As always, it's always good to hear and be heard. So thank you very much for that. Good afternoon, listeners. You're locked into WVOE, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMDAcademy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. All right, folks, here for another exciting show. As a matter of fact, what we're going to do today, this is going to be part one of two. And the topic, yet again, I think we've done that a number of times these last couple of shows, where we kind of take a topic, divide it up, and really focus in on it a little bit more than we normally do with just with our one show. So this is going to be a two-part show. And today, and what we're going to be talking about over these next two shows is a subject that affects a lot of folks. It really does affect a lot of folks. And like everything else, of course, affects, African Americans more than it affects everybody else. So the topic we're going to be talking about these next two shows is going to be diabetes, or what is called the sugar. And not the good kind of sugar, not the kisses, right? So we're going to be talking about diabetes these next two shows. And one of the reasons why we're picking that is that, November is actually Diabetes Awareness Month. So that's one of the things, that's one of the reasons why we're picking this topic this time, is because it's Diabetes Awareness Month. And it's really important that we understand the the importance of diabetes, not only for ourselves, but also on the world stage, understand what this is and, what we can do about it, because it really is one of those conditions that I would say, unlike, like high blood pressure, which is more silent, this one typically gives you signs and symptoms even early on. And it's important that you get it under control, because once you're diagnosed, it really does change your life. It really does change your life. So we're going to talk a little bit about diabetes over these next two shows. So we're going to start out with kind of understanding diabetes, and really kind of understanding Diabetes Awareness Month and what it is. Okay. So November is Diabetes Awareness Month in the United States. It's a tradition that started in 1975 to highlight the growing burden of diabetes. It gained official recognition in 1982 when President Ronald Reagan proclaimed November as National Diabetes Month. Globally, November 14th marks World Diabetes Day, established in 1991 by the International Diabetes Federation and World Health Organization to honor Sir Frederick Banting, co-discoverer of insulin in 1921. Okay. And, the question be, okay, so the United States is doing this, the world's doing this. And the reason why? Because diabetes is a leading cause of death and disability worldwide. Awareness drives early detection, prevention, and better management. And this saves lives. Okay. It saves lives. And it also, reduces, they like to say healthcare costs, but it reduces your costs as well. So diabetes can be really kind of devastating over folks. Okay. So diabetes is a world, really a global condition that has worsened dramatically. According to the IDF Diabetes Atlas, and that's the International Diabetes Federation, in 2024, they estimated about 589 million adults worldwide live with diabetes. That's about 1 in 9 adults. It's a considerable increase from the 2000s, and even from the 2019, and they're projecting about 853 million by 2050. Diabetes caused 3.4 million deaths in 2024, approximating 1 in every 9 seconds, over 1 trillion in global health spending. There's estimate by the CDC that about 38 million Americans have diabetes. That's 11% of the population. So if you're in a group, there are 10 people in the group, at least one of those people is estimated to have diabetes. And the prevalence has risen, about almost 10% from, to about 14% in 2023. So the prevalence continues to grow. And and they're also estimating that about 252 million people globally have undiagnosed diabetes. So this is a condition that really kind of affects a lot of people. And of course, as always, we got to got to look at the black community. The Black or African American adults are more likely to be diagnosed with diabetes and more likely to suffer complications than the general population. So in 2024, non-Hispanic Black adults were diagnosed with diabetes 24% more often than the total US population. And the death rate for African Americans from diabetes is estimated to be about 40% higher. Okay. So about 40% higher. And so this is one of the reasons why, why we do this show, is because we want to let people know that these conditions are important. And like I said, for this one, it's highly important because diabetes does, like I said, a lot of people know about diabetes. And yet again, diabetes is what a lot of people call sugar, the sugar, you got the sugar. And it's very important that you know not only a little bit about it, but you know how important it is, how prevalent it is. And like I said, we're going to talk a little bit about, what exactly, you're dealing with, so we can, so you can be a little more knowledgeable about this condition if either you have it or if other people around you may have it. Okay. All right. So, so kind of one-on-one, probably the biggest thing is like to define what diabetes is, because I feel like a lot of folks may not, you hear about it, and sometimes you hear about it, but you're not, right? You just hear these words that we bounce around, but without really understanding what that is. And so, kind of what I call an everyday definition for diabetes is it's a condition where the body has trouble handling sugar, what we typically will call glucose in the scientific community, that's in the blood. So when you eat stuff, that sugar, either breaks down into sugar, or like I said, if you eat some sugar, it gets absorbed actually into the blood, and there are a number of tissues that actually use that. Okay, so but of course, you got to find a way to get that stuff out of the blood and into the tissue and the cells where it can be used, right? So diabetes is a condition where your body has trouble handling that sugar that gets into the blood. And there's a compound called insulin, right? Your body makes the insulin, and insulin is kind of the key that gets it into the cells where it's supposed to be used, right? And so either the body doesn't make enough insulin, or it doesn't respond well to insulin, or kind of a combination of both. Okay. And what happens is that if you can't get this stuff where it's supposed to be, it just kind of floats around in the bloodstream. And this can cause damage to blood vessels and organs all over the body. Because remember, if this glucose is in the bloodstream and you can't get it out to where it's supposed to be, and it just kind of sits there, it just kind of floats around, and those high levels can cause damage to various vessels and organs in the body. So that's kind of the what I would say, the kind of the plain definition, or easy definition for diabetes. So that's kind of it. Now there actually are multiple types of diabetes. So all diabetes is not the same, and it affects, number one, the risk factors, and number two, how you treat these conditions. All right. So I would say there's a type 1 diabetes. And this condition is what we call an autoimmune. Basically, your body's kind of fighting itself. And one thing that fights is the pancreas, because the pancreas makes the insulin. And remember, insulin is that key that helps you use the glucose in a proper manner. So what happens with type 1 diabetes, for some reason, your body fights the cells that make this insulin. And when it does so, then of course you don't have it around to help you to regulate your blood sugar. Okay. Now, diabetes type 1 is what we typically think of as children and younger adults. It can appear at any age, but for the most part, children and young adults is when it really kind of manifests itself. Now, these people, so people that get diagnosed with type 1 diabetes have to take insulin. They do not have the option of taking, certain types of pills and stuff. And we'll talk about that a little later on. But type 1 diabetics, are kind of the one marker about this, is that they have to take insulin. They have to take insulin every day. If they do not, then they get they can get extremely ill. They actually can die if they don't take their insulin. So that's what the type 1 diabetic is. Okay, so that's type 1 diabetes. Then we have type 2 diabetes. Okay, and type 2 diabetes actually is the most common type of diabetes. This is the majority of people, like of all the people that have diabetes, this is the majority of cases, okay? And in type 2 diabetes, your body actually makes insulin, but what happens is that there's the insulin's floating around, but your body is, it just can't respond to it, for various reasons. But like it just doesn't respond to the insulin that your body is producing. And so when that happens, your body doesn't respond to that insulin, then that blood sugar also kind of just floats around. It's high levels. And of course it does the damage to the blood vessels and organs, kind of like, the other type of diabetes. So that's what this is. So remember, type 1, you do not make insulin. Type 2, you make insulin, but you don't respond to it. Now, type 2 diabetes is a lot of times is linked with excess weight, inactivity, so you're not moving around, family history, and age. Okay, but it can occur in younger people as well. As a matter of fact, it's starting to occur in younger people as well, which is a little unusual. But one of the things that they're noting is that a lot of times this is, this is typically related to also weight. So it's not just as obesity increases in young people, then the type 2 diabetes increases in young people. So that's where that's come from. So we got type 1, your body does not make insulin. Type 2, your body makes insulin but does not respond to it. And this is the one that's related to weight. Okay. Then we have a gestational diabetes, and this is for the ladies out here. So this is a diabetes that occurs during pregnancy and someone who did not have diabetes before. So this is someone that does not have diabetes. They get pregnant, and as part of screening, they're found to have developed diabetes. And that's what we call gestational diabetes. Now, the important thing about this is that it increases the risk for both the mother and the baby, and raises the mother's risk of developing type 2 diabetes later in life. So this is for the ladies. If you were pregnant and you get diagnosed with gestational diabetes and maybe resolved after the baby's delivered, it is important to keep screening because you are at risk of developing type 2 diabetes later in life. Okay, so that's type 1 diabetes. We talked about that one. Type 2 diabetes. We talked about that one. Gestational diabetes. And then this one, the last one we're going to talk about in terms of types of diabetes is pre-diabetes. And one of the reasons I'm pointing this one out, because this is one that a lot of people don't think about it, is that, this is a great opportunity for prevention. Pre-diabetes is a marker for prevention. So if you get diagnosed with pre-diabetes, a lot of people can really turn this around with diet and exercise. And so what is pre-diabetes? And kind of like it says, it's a condition where your blood sugar is higher than normal, but not quite high enough to be labeled diabetic. Okay. And, if you find this, then you can kind of reverse it around, right? So pre-diabetes is hugely important. And I like for people to understand that, because sometimes people, because it doesn't cross into the diabetic realm, a lot of people like to say, oh, it's not that bad. But no, this is a great warning sign. It's a great red flag that you need that something's going on that you need to reverse, right? So your blood sugar is higher than normal, not enough to be called diabetes, but like I said, it's a marker that you're at risk of developing diabetes. And about 98 million U.S. adults, so more than 1 in 3, have pre-diabetes, and more than 8 in 10 do not know it. Okay, so that's okay. So 1 in 3 people, so about a third, have pre-diabetes. So about a third. Okay, and then more than 8 in 10. So like I said, there are 10 people with pre-diabetes, about 8 of those people do not know it. Okay. And so this is why I like to push this particular issue because this is a great opportunity there. And it, like I said, it's a critical warning sign. It's the ultimate red flag that it is time to change, to do some lifestyle changes, to change your life around. I've seen multiple people, once they find this out, they turn to, they eat better, they exercise better, they find out whether they got sleep apnea and stuff of that nature, turn their life around, lose a little bit of weight, and they actually get their pre-diabetes under control. You actually can pretty much cure pre-diabetes with simple lifestyle changes before you have to start taking medications. So a lot of those folks, because I know a lot of people don't want to take medications. They're like, oh, I don't want to take a medication. I don't want to take a medication. Well, if anyone ever tells you got pre-diabetes, you're on the path to medication. And one of the things about diabetes is like, yeah, you're going to start out with this pill. And then you're going to develop another condition that's going to require another pill. And then there's going to be something else that requires another pill. It's a path of pills. So if you get told you got pre-diabetes, work on that, get that under control, especially for those of you who don't want pills and you're concerned about, what the government doing to you, stuff of the nature. If you don't want that path and somebody ever tells you got pre-diabetes, then you make sure you start the process of lifestyle changes. Okay. All right, great. So we talked about that. So we talked about Diabetes Awareness Month. Got a little bit of information about there. We defined diabetes. Okay, your body can't regulate sugar either because you don't make insulin or because your body does not respond to insulin. We talked about the major types of diabetes. So you got type 1 diabetes, you don't make insulin. Type 2 diabetes, you don't respond to insulin. Gestational diabetes, you get diabetes during pregnancy, which increases your risk of diabetes later in life. And then pre-diabetes, the ultimate red flag for lifestyle change, right? That's the ultimate red flag for lifestyle changes. Okay, so what we're going to talk about a little bit next. Okay, so what kind of risk factors? Who's at risk for diabetes and these complications? So the risk factors, these are official risk factors, of course. Family history of type 1. This is for type 1 diabetes. Remember, these are multiple types of diabetes, and so they each have their own sort of risk factors. So type 1 diabetes, family history of type 1 diabetes would be a risk factor. There's certain autoimmune conditions, and autoimmune conditions are where your body kind of fights itself, right? Now, one thing about type 1 diabetes is often not related to weight or lifestyle. So you can't really cause type 1 diabetes by eating too much sugar. So type 1 diabetes is really a little more complicated there, right? So it's not as simple as a type 2. So, but like I said, if you do have a family history or if you have certain autoimmune conditions, you definitely want to make sure you get screened. And one of the things about type 1, and we might talk about this a little in the next show, is that type 1 typically gives you very significant signs. Like those people are usually really sick. And yet again, most of these folks will develop will manifest their diabetes during their childhood. Okay. Now, next is type 2 diabetes. Okay. So what kind of risk factors do you have type 2 diabetes? Overweight and being overweight and obese, especially that weight around your waist. That's the big one right there, right? So that's one of the big ones. Physical inactivity. So if you're not getting some activity in, and of course, activity, we like for people to get 7,000 to 10,000 steps a day. We like for people to get about 150 minutes of moderate exercise weekly. So the less active you are, the more likely the more you're at risk of developing type 2 diabetes. So you want to make sure you're getting to move around. So like if you're just going to work, you're sitting down all day, then you come home and you sit down on the couch, yeah, you're increasing your risk of type 2 diabetes. Okay. The other risk factors for type 2 diabetes, family history of diabetes is also a risk factor for them as well. And then there's certain ethnic groups. So being African-American, Hispanic, Latino, Native American, Asian American, or Pacific Islanders, all of them, or all of us, I guess, all of us are at risk of developing type 2 diabetes, just that ethnic groups alone, right? And age 45 or older was thought to be a risk factor, or supposed to be a risk factor, although type 2 is appearing in younger and younger adults. So, the question is going to be, is that age going to drop down a little bit more? Then a history, like I said before, history of gestational diabetes or delivering a baby over 9 pounds kind of increase the risk of type 2 diabetes. People that have high blood pressure, abnormal cholesterol, polycystic ovarian syndrome. So those people would need to be, screened for type 2 diabetes going on. And unhealthy diets can also contribute as well. So that's the risk factors for type 2. So type 2 diabetes has a laundry list of risk factors associated with it. Then we have gestational diabetes, and the risk factors for that are being overweight or obese before pregnancy, what they call older maternal age, over 25 or 30. It doesn't take much there. A family history of diabetes, prior gestational diabetes or a very large baby, and then belonging to high risk ethnic groups. Yet again, African American, Hispanic, Native American, and certain Asian groups. Okay. All right. So, um, so we got that going on. We talked about, what diabetes is, the types of diabetes, some of the risk factors, and then you want to talk about, how do we get this diagnosed? How do you do diabetes? Now, a lot of times, if anyone's ever gone to a health fair, a lot of things they do there will include screening for people to have diabetes. And so there are a couple of tests that we do to kind of screen to figure out if a person has diabetes. Now, one is something called an A1C, hemoglobin A1C. This is extremely important for anyone that's at risk of diabetes, that has diabetes. Please know what this is. Hemoglobin A1C. What that number is, it's your average, is associated with your average blood sugar over the previous 3 months. Okay, this is a key test. I want everybody to remember this one, right? So if someone says they have a hemoglobin A1C that's high, or that you got a loved one that's getting diabetes and they don't know that A1C, they need to learn up. They need to remember this word. They need to write it down. They need to follow this. Somebody needs to be really following this. Okay. So what are the A1C numbers? So normal A1C is below 5.7%. Pre-diabetes is 5.7 to 6.4%. And diabetes is 6.5% or higher. So if you got an A1C and it says 6.7, 7.0, 10, you pretty much have diabetes. Okay. Now the pre-diabetes, and like I said, that's the magic point I like to point out for people. If that A1C is between 5.7 and 6.4%, you have pre-diabetes. Somebody should be telling you got pre-diabetes, and there should your clinician or yourself needs to come up with a plan to change lifestyle. There's something going on in lifestyle that's probably driving the pre-diabetes. So you want to work closely with your clinician. And if you need to get referred, like I said, if you need a lifestyle expert, you can actually look up lifestyle. I'm a lifestyle medicine physician. So, you can look up lifestyle medicine physicians that can talk to you about how to manage this with lifestyle changes, and see if you can get this under control. Now, I never guarantee it, even in my yet again, I'm not your I'm a doctor. I'm not your doctor. So of course, it's education and entertainment. So even for my patients, I always tell them, like I said, not everybody's going to be able to get their numbers completely normal, stuff of this nature. But all changes. All lifestyle changes pretty much are helpful, and especially for sedentary people. For sedentary people to go from sedentary to some level of activity really improves people. So for people in that pre-diabetic range, someone should be talking to you about changing the diet, exercising, so that you can see if you can get those numbers down to avoid medication. Because even if you stay in the pre-diabetic range for a while, a lot of times people will start to want to give you some medications to keep you to minimize your chance of developing complications later on. So that's for pre-diabetes. But for the diabetic population, of course, that's got to be treated. You got to manage that. We might can play around if you a new diagnosis, not too many complications. Mike can work on lifestyle changes to see if that number will drop. But for the most part, a lot of these people just you're going to need medication. Okay. And at first, now you might can change lifestyle enough to get off of the medication, but initially you're going to need some meds for the most part. But of course, talk to your doctor. Then of course is fasting plasma glucose. This is a blood sugar level after at least 8 hours of fasting. So no calories. You can drink water. What we like to call fasting. So normal blood sugar is going to be less than 100. Pre-diabetes, 100 to 125. Diabetes is going to be 126. And that's pretty much on two separate tests. So usually it's not just one test. You usually have to get two tests to get the formal diagnosis of diabetes. Okay. So then you got oral glucose tolerance test. This shows how your body handles sugar over 2 hours after a sweet drink. A lot of times this is used more so for in pregnancy or special situations. So the most common things you're going to see are going to be the A1C and the fasting plasma glucose in terms of getting diagnosed with diabetes. Okay. Okay. And then, of course, I got some recommendations for people that, who should get screened. And of course, the U.S. Preventive Service Task Force recommends screening for adults 35 to 70 who are overweight or obese for pre-diabetes and type 2 diabetes. I think a lot of folks just, pretty much you just get screened. Especially anyone that's got if you got a family history, if you belong to one of those ethnic groups, if you're a little overweight, all these things, you really want to talk to someone about getting screened for this, even at an earlier age. Okay. Because like I said, they're, 35-year-olds getting diagnosed with pre-diabetes and diabetes. So they're, sometimes the earlier the better. So I always encourage people to check with their primary care clinician to see if they should get screened. Okay. All right. All right. That's pretty much, I guess, the last thing we want to touch base about a little bit now. We'll probably talk a little bit more about this during the next show as well. And that is, yet again, I like to really emphasize this pre-diabetes intervention. Pre-diabetes is like a traffic light, but honestly, I some people call it a yellow light. I call it a red light because you really need to find out what's going on and turn things around because you don't want to get the diagnosis of diabetes. Pre-diabetes, at least from my experience, I see people turn that back around. It's a lot easier than diabetes itself. Lifestyle changes can really cut the risk of developing type 2 diabetes by over half in a lot of people. Okay. And so the key lifestyle change strategies that should be addressed. And like I said, you should talk to your clinician about or give, reach out to PressureMD is you want to talk about healthy eating. So whole food, plant predominant or plant-based diet. You want to be making sure you're doing some of that stuff. You want to avoid, these sugary drinks and fried or highly processed food. You want to avoid those things. And that's kind of a general just about for everybody. Physical activity, kind of like we said, you want to be aiming for at least 150 minutes of moderate exercise a week. And you can start, as long as you're otherwise healthy, you should be able to, most people can handle a walk. But if any doubt, talk to your primary care and they can kind of talk to you about, whether or not it's okay for you to do that. And then weight loss, you want, even if 5 to 7% of your body weight. So it might be, if you're 200 pounds, it might be 10 pounds down. It can make a big difference in diabetes, your pre-diabetes, it's hypertension. It really does matter. So if you know that you're overweight, like I said, you definitely want to do the healthy eating, physical activity, and you want to try and lose a little weight. And then again, under the direction of a physician, talk to them, make sure they're kind of monitoring you and seeing if there's any risk factors for anything. So you want to work on that. Okay. And I know a lot of people don't like BMI. There's a lot of, pros and cons about it, but BMI is a pretty good indication. Like if you got a BMI and your BMI is 35, yes, it could be muscle mass, but if you ain't lifting weights, it's probably, if you're not lifting weights, you eating burgers and fries all the time, your BMI 35 is not likely to be secondary to muscle mass. People can be different, and it's not for your big bones. It's not for your big bones. You got this, it's adipose tissue, i.e. fat. So you want to get that stuff. You want to get that stuff down. Technically speaking, you can actually get certain tests where they can actually see what percent of body fat you actually have. So if you actually have questions, you can actually request those sort of things. But like I said, the obesity piece, I know we're talking about diabetes, but obesity drives diabetes, drives hypertension. So it's very important to kind of get that under control. And then sleep and stress. Poor sleep and chronic stress can also worsen blood sugars. So you want to make sure you're getting that stuff taken care of as well. Okay. So, so this is pretty much wrapping up our show for today. So, I think our call to action for this time is to make sure you get screened. Yeah, actually, first thing, make sure you got a primary care doctor. Make sure you got a primary care clinician. We're going to keep talking about this every time. Make sure you got a primary care clinician. Reach out, get lined up with somebody. Okay. Because once you get that, then you get screened. Okay. All right. Then you get screened. Once you get screened, now we can start making a health plan for you. Okay. So, so don't wait until you get signs and symptoms. I mean, like I said, one of the things that, I see as, especially now that I kind of practice medicine around different places, and, it just hurts to see, a 55 or 57-year-old guy. And like I said, for, it affects everybody, but it does seem to be African-American males, brothers, that are 57 years old, and I saw a guy not too long ago that he lost his eyesight. He lost a sight in his right eye, and it's why it was because talk to him. He says it's because of diabetes. So you lose sight in your right eye, and actually, this guy actually, he lost sight in his one of his eyes, and it was because of diabetes. He's like, hey, like, look, and he, and being honest, he's like, hey, look, I didn't get it under control, and this stuff happened to him, and he's, so these complications for diabetes can be severe. They can affect you a lot earlier than you think. Everybody is different, so like I said, just because your uncle survived 30 years without controlling his diabetes does not mean it's going to be you. And diabetes complications can be quite ugly, because one of the things about diabetes is that if it's really bad early on and you don't get it under control, and then say 10 years later you start getting it under control, the ramifications for having uncontrolled blood sugar, and for a long period of time, can manifest themselves even after you get your blood sugar under control. So it is a tricky one. So that's why PressureMD Academy, Dr. Brown is working with WVOE to get this word out, because we want to make sure that people understand how important this stuff is, that you go out, that you get yourselves a primary doctor, that you get screened, and you choose life, that you choose this better way of living. Okay. So make sure you do that. Feel free to connect with PressureMD Academy on YouTube, so you can follow some of these. Reach out if you need to, PressureMD.com, and just let us know if there's any way we can help you as well. And outside of that, I think we're gonna wrap up today's show, and we'll be back again next week to talk a little bit more about diabetes. Okay. Until then, you all take care. Have a great day. Have a great weekend, and we will chat with you later. Thanks for tuning in.